And you will hear something later today from someone who's here to speak on behalf of this bill, the author, Mr. Dan Walter, who wrote Collateral Damages. On the back of the book it reads, from his introduction, as to why he wrote this book. My larger purpose in writing this book is to tell Pam, whom is his wife, that she does matter, and that her life is important, and her story is important, and it deserves.
I saw one summation here of this bill. It says that the state has a compelling and urgent need to require hospitals to account for medical harm to patients and to issue public reports regarding the number of incidents and the type of harm that occur at each hospital. And I would add that this state and this committee has a responsibility to do that. That is your job. Because who's running the system now is our corporations. And I'm sure everybody in this room is familiar with lobbyists from pharmaceutical companies, device manufacturers, hospital corporations. I'm sure you're getting pressured and pushed from all sides. This woman here and myself are just regular people. And you are supposed to be our voice. You're supposed to be doing this for us. And we shouldn't be having to go through this stuff. It's because people here, I really applaud Michael Summers here, because he's one who's speaking truth to power. He's saying this isn't right, and maybe it's going to cost you, maybe it's going to inconvenience you, but we want transparency, accountability, and that's not too much to ask when your life is on the line. Because I know almost everybody I talk to, when I tell them about what happened to my wife, they say, oh yeah, my uncle did, or my cousin, or my brother, or my sister, they went in there. There is a crisis of patient safety, and something's got to be done, and it's your job to do it. And if these guys, the lobbyists, are going to say, no, you can't do that, it costs too much money, you have to stand up and do your job. And what happened, but my wife was a nurse, and the way I met her was my dad was sick in Florida, and he was in the hospital because of a staph infection that he had picked up from a different hospital previously, and nobody told him about it, ever. And the only way I found out is that I wound up marrying his nurse. And she told me all the things that went on behind the scenes. The doctors weren't going to tell me, nobody. And I found out that's what happened, and my father died. So we come up and moved here to Annapolis. My wife worked at Anne Arundel Medical Center. She had, for a while, she had arrhythmia. I took her up to Johns Hopkins. They say, we have a procedure here. It's fairly new, but we've done tons of them. We've never had any problems here. The message to us was, this is a pretty well-vetted procedure, and you're safe in my hands. The head of the EP lab told us that. He was going to do the job. He's the best in the country. This is the best hospital in America. And what happened was, they let a trainee do the job, and this was a catheter that they snaked up into her heart, and it got caught in the mitral valve muscles of her heart. And it was a new instrument. It was an investigative procedure, an investigative instrument, and a trainee. And they couldn't get that wire out of the mitral valve muscles. So finally, they called somebody in, and he just rolled the dice, and he yanked it, and he ripped out her mitral valve muscles. And they continued with the ablation procedure because, little did we know, there was a study in progress, and they wanted to have her on the books as having a completed ablation procedure so that they could say, well, here is a successful procedure. And the doc comes out shortly afterwards, and he says to me, well, I'm sorry, I turned my back, and the catheter got lost, and that's how it got in the mitral valve. It was my fault. Because at that point, we didn't know a trainee was doing the job. And they didn't find out till 4 years later when they let it accidentally slip. And they parceled out the records, 10 pages here, 20 pages there, and they lied and they fought and they obfuscated every inch of the way. And one of the ways that this bill would have helped is that this doctor told us this procedure, I've done lots of them here, and there's never been any problems here, no injuries, that was a lie. And if there was a place where I could just look, instead of pawing through medical journals and things like that, if I could just look and say, well, they've done 40 of these, and there have been 12 complications, quote-unquote complications, and that covers a lot of sins. A lot of times, your family's out there in the waiting room, and the doc will come out and say, oh, well, sorry, the complication came up, you didn't make it. And you go, well, thanks, doc. I know you did the best you could. What you didn't know is that maybe there was a pharmaceutical rep in there or a device rep in there, and they were trying something different or something broke or, their first reflex and reaction is to lie and stonewall. And they've got the money, and they've got the power, and they've got everybody believing in the infallibility of medicine, and nobody wants to question their doctor, and nobody wants to believe the system is corrupt. And, right now there's a epidemic of infections in hospitals, MRSA, and DIF, and all kinds of flesh-eating horrible things. That hospitals are dangerous places to be. And I say, there's an old saying that sunshine is the best disinfectant all around. And that's what you guys need to be doing here. Shed some light. That's all this is. Everybody else, every other business, you're held accountable for your mistakes and your errors. And for some reason, medicine, they get a pass on things. So I applaud Delegate Summers, so that things that happen with this woman and my wife, they don't have to happen. It's unnecessary. And the cost, my wife, that procedure was supposed to cost $1,500 or something like that. And it wound up, she's disabled, she's on Medicare for the rest of her life, and we got a bill from the hospital for $120,000. You're not saving money here. So I think you should do the right thing and push this bill through. Thank you.
Thank you, sir. Are there any questions, this panel? Thank you very much for your time and your testimony.